think that the independent fellowship and integrated residency complement each other very well here at the University of Minnesota. Our independent fellowship is an additional 2 years after a trainee has completed their general surgery residency to learn more about the specialization of vascular surgery. Our integrated residency is an immediate 5-year program that applicants are able to enter after completing medical school.
It's great for people who know that they want to focus in vascular surgery coming out of med school and really hone in on that skill set.
The difference in these training paradigms allow for cross-collaboration and learning between the trainees, not just from the faculty.
Our program has a very strong base in general surgery. We spend much of the first 2 years aligned with the general surgery program, and that's focused really on building the general surgery skills, both basic technical skills and as well as post-operative and preoperative management of patients.
The first year is about kind of getting your bearing and getting a feel for vascular surgery as a specialty. And then as you gain the trust not only of your colleagues and the attendings, but also in yourself, you advance to a more kind of responsible role where you have a direct effect on patient care and you make the decisions. You're having more autonomy in the operating room, and so the cases really begin to feel like your own.
One thing to emphasize about the program is the quality of the people, and the reason I chose to stay at the university for my training was because of the people.
It sounds silly to say, but it's somewhat of a feeling you get. The Minnesota nice is really true here.
So I would say that I feel very supported being a female vascular surgeon that is also a mom. Obviously vascular surgery and being a surgeon is a huge part of my life, as is being a mother, and both of those I think are obviously the most important titles that I could ever imagine having. I think this program makes you feel very supported from all of those aspects.
Our program is primarily rooted in clinical research, although we have multiple partnerships with the Department of Biomedical Engineering.
There's a lot of work to be done here. We have a great patient data set, and really we're working on expanding that.
We have monthly research meetings, and we focus on case presentations, upcoming deadlines for the different vascular societies in hopes that we're all going to be up there on podium for presentation.
The vascular and endovascular training programs at the University of Minnesota have a wide range of clinical practice and faculty with multiple different training locations and backgrounds, which allow graduates to come out of training fully prepared with multiple different ways to tackle complex problems.
Having interactions with those patients, I think, helps both residents and fellows develop empathy, good patient relations, and overall become a good clinician.
I think that the more that you see in any training program, the better well served you are to go out into the world, and the Twin Cities have an incredibly diverse patient population.
We have a couple hospitals that are more based on what we call, I guess, the bread and butter of vascular surgery, so you get a very good feel of that aspect as well. And so you become comfortable from an endovascular side for simple diagnostic procedures to interventional as well, and then complex bypasses as well as aortic work.
And all these patient groups have different medical problems as well, and that helps us develop, I think, more holistically and into a much better clinician.
Life outside of the hospital here in the Twin City is fairly robust.
If you're a music fan, a lot of rock concerts or concerts in general.
There are a number of different things to participate in here in the urban area.
And then we have a lot of sports franchises, so there's something to do for everyone.
Different theatrical performances, different concerts, different sporting events.
I'm a bit of a foodie and love to go to all the different restaurants here.
In the summer and spring especially, we try to spend as much time outside as we can. Minnesota is a state where if you dress right, you can always find something fun to do outside.
I have a dog named Maisie who's really important to me, and so exploring local parks and places that we can take her on walks has been really great.
It's a great place to raise a family and enjoy time with the kids on the weekends.
The Twin Cities, Minneapolis, and St. Paul are an excellent place to live. They have the amenities of a large city with some of the conveniences of a smaller city. There's a lot of outdoor activities, concerts, music, restaurants, and really anything from all art and culture that anyone could be interested in.
So I feel in general that this program has given me all the training that I could have hoped for in the vascular surgery world.
This has been an incredible program in terms of preparation for being out in the real world.
Our program exposes us to the full breadth of vascular surgery, so there's really not a procedure that we're not exposed to or trained in. Everything from the most simple procedures to the most complex.
You have a wide variety of cases, you have good mentors, good teachers, and you learn all these different techniques, both surgical techniques as well as how to deal with different groups of patients over your either 2 years in fellowship or 5 years in residency here.